What is a strike nurse? So a strike nurse is a type of nurse, a type of travel nurse who goes in to work when some type of hospital or healthcare facility go on strike. You come in, you fill in the gap, and it could be very stressful because you just never know. So why do nurses go on strike? There could be a number of reasons why nurses go on strike. Most of the time it's the pay. They want better pay for the heavy workload and the wages and the benefits that they might be lacking, and they feel like they deserve better. Sometimes you do have to speak up for yourself and your colleagues. So that's one of the main reasons why they go on strike. It could be something that's the patient safety. You putting your not only your license at risk, you're also putting these patients at risk too. And sometimes somebody needs to come in and step up so that we can safely take care of our patients, because that's what we do. Now, where can you find these type of nursing jobs, these strike nursing jobs? Nursing board, job boards, newspaper, check your local listings, or you can go on a website like usnursing.com and they will have a list of potential strikes, and you just go in there and you find the state that you want to work in, or probably it could be your state. You go on there, look it up by the state, you see all the job listings, you pick out the job that you want, your specialty or something, the experience that you have, you apply for it, and you wait for your call. Another thing, some things you want to consider when taking these strike nurse jobs. Obviously, the constant traveling. You have to be ready to go. It could be a potential strike coming, and you need to be there in 2 days, and you might live, 20 hours away. You have to be ready to go. In most cases, the companies will compensate you for your travel. They will pay for your housing, but I'm getting an RV, so I'm going to live in my RV. What are some considerations that you might want to take into account when being a strike nurse? Obviously, the work environment. You have to be ready to go. You might be far away from home. You got to take into consideration these contracts. Every answer to all the questions you may have may be simply found in your contract. Your contract may say 4 weeks and you only do 2 weeks. So what happens from that point on? You may get paid for the entire 4 weeks. Another thing you want to consider is ethical issues. You see your colleagues are out here fighting for better pay, and you come in as a strike nurse and you making 4 or 5 times as much as they're making. So the money is there somewhere, it's just not there in that facility, and you come in and you don't know this facility like them. They've been here all these years. You come here for a day, and instead of they may be making $50 an hour, and you come in, you making $250 an hour. That's something that you need to consider, because together we are here to take care of our patients safely as we can. So take that into consideration. Another thing, the constant traveling, your nursing license. Are you in a compact state or a non-compact state? Do you have a multi-state license? I have a multi-state license. I work and reside in 2 different states because of where I live. I live on the border of 2 states. So the state that I actually reside in, I do not have a license for that state. But the other state that I've been working in for years, I do have a license for that. So, and that's because obviously it's better paid in the other state that I do not live in. And I've always worked in that state for many, many years. So that's why I chose to not get a license in Illinois, which is, like I said, is not a compact state. Now, how much do these strike nurses make? Of course, you want to know that. Strike nurses, they make a lot of money in a short period of time, but with long hours. Some can make up to $100, $200 an hour. It's all in your contract, so read your contract carefully. And sometimes you will be working 50, 60 hours a week. If that's what your contract states, you have to fulfill that. You may be working 12, 14 hours a day. But if that's what you signed up for, you have to fulfill that. Now, I told you where to find these jobs. I told you why these jobs exist. Well, now, what are the pros and cons of being a strike nurse? I mean, the pro is obviously the pay. You make a lot of money. The ability to travel. And sometimes you may not be gone that long. You may not, like being a travel nurse, you probably be gone 13 weeks. Strike nurse, you may be gone for a couple weeks or a couple days. It all depends on when that company and their nurses can come up with some type of agreement. That's how long it's going to be. And by the time you get there, the strike may be over. And what do your contract says when something like that happens? Like you're going to get compensated in some type of way because you showed up and you agreed to work this assignment. However, you didn't get a chance to because they sort out the problem. So they might say, okay, we're going to pay you for at least a week. You take that money and you go on to the next job. Or you can just take a vacation or just take some time off of work. Now, the cons about this job is the stress, the emotional stress, the benefits. The benefits may not be what you want, or kind of like why those nurses on strike in the first place. And like I say, the constant going up and down and you just being placed in a facility without proper orientation. Most of the time you go to a job, you might be on orientation for a week or two. And if you're a brand new nurse, you know you're going to be on orientation for quite some time. So sometimes you are just thrown out there to the woods, as they say. But you have to have that fast-paced mindset, because you have to get in there and get things done. You may have an hour orientation. Meanwhile, the nurse who actually worked in this facility, when she got the job, she might have been on orientation for a couple weeks. So that's something you have to be willing and ready to just jump in, take care of these patients, make your money, move on to the next. And y'all, I think that's all I have with this strike nurse. I hope that answered your question about strike nursing. It's not for everyone. Would I do it? Maybe, but no time soon. I prefer just being a regular old travel nurse. But you never know. My facility might go on strike one day, and I just might step in and be the strike nurse. No, I'm just joking. No, I'm not. I don't know. See, that's that ethical dilemma you get put in situations like that. Do I do it? It's so much that can happen. But, I hope you guys enjoyed this video. I hope you learned something. I greatly appreciate all my new subscribers. Thank you so much. I appreciate the response to these videos. Like I said, nursing is my passion. RV is becoming a lifestyle for me. So when I do buy my RV, you guys are going to be there every step of the way. Every step of the way. When I first take my first travel nurse assignment, I'm bringing you guys along the way. And thank you for watching this video, and I will see you guys in the next one. Appreciate you.